Well, welcome everybody, and thank you, Senator Hassan, for joining us here at Dartmouth Health. But more importantly, thank you for championing an initiative that is going to help our patients and moms and families all over New Hampshire. Getting legislation across the finish line is no easy feat. It's probably harder now than it was a few years ago, but it takes really a passion and a commitment, as well as a very organized way of identifying all the people that are aligned with us. And you've done that incredibly effectively.
Thank you.
You have been a champion for maternal health and children's health, and we appreciate it as the only children's hospital in the state. And I would say, Maria, if we added up all of our sites, we probably offer more maternal health care than anybody else in the state of New Hampshire. It is our mission to provide high quality care to all of our patients, but when we start to think about populations, it becomes even more important. It's not just the people we care for within the walls of our facility, but the people that actually live in our communities, and making a measurable and sustainable difference in the quality of their lives is a high priority for us. So thank you for being here, and thank you for everything you do for New Hampshire and the country.
Thank you very much. Thank you for having me here today. And in a minute, I'll ask everybody just to go around and introduce themselves so the whole room knows what perspective each speaker has. What I thought I'd do is just make a couple of opening remarks and then have you guys introduce yourselves and then kind of kick things off with a question so we can have a discussion. And I just really want to reiterate, Dr. Conroy, how grateful I am for Dartmouth's work throughout the state on so many different levels. But for today's purposes, we are here to talk about the challenges that mothers face. They face, obviously, immense health challenges before giving birth. They have to be properly cared for during the birthing process, but then the postpartum years, months and years, can take their toll as well. And so it's important that not only that moms have caregivers and healthcare professionals who understand that, but that we really do everything we can to support all of you in this work so that the resources are there and the expertise is there, and that we have a strategy, not only in New Hampshire but nationally, that really brings healthcare providers together to work together to help moms. We've made some progress in Congress recently. Last year, I worked together with Senator Tom Tillis from North Carolina to introduce what we called the Triumph Act. It's a bipartisan bill. It's Triumph for New Moms Act, to be specific. And the president recently signed that bill into law. And one of the things that it does is take really long overdue steps to coordinate a federal response to address postpartum depression and anxiety, as well as what is a devastating rate of maternal suicide. So this bill creates a federal task force and national strategy to improve maternal mental health outcomes specifically. We specified in the bill that the task force has to be stood up, I think, by March or the end of March. So we're trying to push this on what in the federal level is a pretty quick timeline. And then we direct the Department of Health and Human Services to use this task force as a way to work with states to increase mental health prevention and treatment services for new and expectant moms. A couple of other things. The year-end funding bill, which some of you may have heard of referred to as the omnibus, allows states to expand Medicaid access by enabling them to permanently provide a full year of postpartum coverage for mothers on Medicaid. That is a critical step to help more moms get the care they need for longer. I'm very pleased that State Senator Becky Whitley is here with us today. She, along with, I think, Senator Prentice and others, are spearheading the effort to get that Medicaid change done here in New Hampshire, because it has to be done on a state level. But that would be a really important step forward. Moms knowing that for the full year after they give birth, they have Medicaid coverage, including mental health coverage. And at the same time, I want everybody to be aware that while we are moving forward in some ways, we have real threats on the horizon that would pull us backwards. Right now, as you all probably know, House Republicans are refusing to raise what's known as the debt ceiling. That is simply a mechanism that allows the United States of America to pay its bills for bills that have already been expended, already been authorized. And I just want to be clear about what the impact of allowing the United States of America to default on its bills would have, obviously have a devastating impact on our economy. But when we're talking today about healthcare and Medicaid access, it's really important to understand that the threats they are making right now, not to raise the debt ceiling and allow America to just pay its bills, is coupled with a threat or a demand that we cut federal spending. And when you look at what they are proposing, threats to Medicaid are definitely part of their agenda. So I want people to be really clear that this is not just an abstract issue that they hear about on the news, that this insistence that we allow the country to default would be devastating for our economy, a lot of the people who you all serve, but it would also be devastating for our healthcare system because of the impact on the funding that we know is so important to help people live strong and healthy lives and participate in the economy and contribute and be self-sufficient. So I'm going to continue to work with my colleagues in the Senate to push back at that effort and make sure that we do what we need to do to protect the American economy and to protect critical resources and funding and programs like the ones we're talking about today. I also want to make sure that we're working together to protect vital services and strengthen those vital services and not take a step back but step forward so we can improve outcomes for all people who access the healthcare system, but in particular for today's discussion for new moms. So I really look forward to our discussion. And maybe with that, folks, why don't you go around the room and just introduce yourself briefly, and then I'll probably start with a question for Dr. Conroy. So you all know Dr. Conroy. Why don't we start over here? Yes.
My name is Maria Padina. I'm the Chief Medical Officer for Dartmouth Health Community Group Practices, and I am actually an obstetrician gynecologist as well, so I'm very familiar with the challenges that many women face when they have limited access to health care postpartumly.
I'm Susan Stearns, the Executive Director of NAMI New Hampshire, and thank you for including NAMI New Hampshire here today on this really important topic. NAMI New Hampshire, with the help of Heather Martin, actually really worked hard last year to try and get this bill across the finish line here in New Hampshire. We look forward to working with all of our partners to make this a reality in terms of Medicaid coverage for that first year postpartum. We know how essential and life-saving it will be.
Thank you.
Good morning. My name is Jessica LaChance. I'm the director of our Rapid Response Team for the Mental Health Center of Greater Manchester. And we provide 24/7 access to crisis services and emergency evaluations to folks in Manchester and also as part of a statewide model of rapid response. So anywhere within a 50-mile radius of Manchester we respond.
Great, thank you.
Good morning, my name is Carrie Sanborn. I'm the other director of the Rapid Response Team at the Mental Health Center of Greater Manchester, focusing more on the emergency rooms here in Manchester and also our homeless outreach program, providing the psychiatric crisis evaluations.
Great.
Good morning. I'm Maggie Minnock. I'm one of the directors of Population Health at Dartmouth Health and also the executive director of NEPQUIN, which is the Northern New England, so all 3 states, perinatal quality improvement network. And we are a network of about 50 birth hospitals in Vermont and New Hampshire, and many in Maine, who work together to take care of, speaking of population health, to take care of all of the folks in our region, the moms and babies. We implement safety bundles and do educational conferences, that sort of thing. So we work together, toward the better health for moms and babies.
Great, thank you.
Morning, everyone. My name is Mackenzie Nicholson. I'm the director of Moms Rising here in New Hampshire. Super excited to work on the Momnifest with you all this winter. And I happen to be a mom who was low income, who benefited from Medicaid. I have 2 little ones now. Definitely had postpartum depression. I'm okay now, but I'm excited to do this work to make New Hampshire a better and a safer place for moms.
Thank you.
Hello, my name is Nancy Glynn, and I am a campaign director for Moms Rising. My job is to go out and I chat with moms all over the state to really hear their stories and see what their struggles are, because for moms, sometimes we just get lost in the shuffle of everyday life. So that is what I'm doing here today. I'm also a mom as well who utilized Medicaid when I was pregnant with my boys as well.
Thank you.
My name is Heather Martin. I work here at Dartmouth Health, Pediatrics, Children's Hospital Pediatrics. I'm a maternal mental health advocate, and I went to see you in Washington, D.C. It's so exciting that you're here, and I'm so thankful you're here today. Thank you.
No, thank you.
You'll hear a little more of my
Yeah.
story after, but
Okay.
I'm so appreciative that you're here because
All right.
I've been working so hard to get moms help here in our
Yeah.
state.
I
Thank you.
appreciate that very much. And this is one of those topics that so many of us have personal experience with in one way or the other, that I think it is a particularly important one, but also can be emotional to talk about. So let's just start, though, with Dr. Conroy. So first of all, congratulations on being chair-elect of the American Hospital Association. We are
Okay.
very, very glad to have you in that role. And look, your role as chair of the Hospital Association is going to be really important in informing federal policy as we talk about how to go forward in healthcare. But just to kick off the discussion today, can you talk about how having a comprehensive national strategy like the one we have now required through the Triumph Act could support mental health work here in New Hampshire?
Thanks, Senator Hassan. Yes, it's interesting. I just came back from a American Hospital Association retreat where we were really talking about the future of healthcare across the country. And when we look at some of the services that are highlighted in the Triumph Act, we consider those essential services. Unfortunately, they're services that do not pay very well, both federally as well as in the state of New Hampshire. And what we're seeing is a growing reluctance to either expand those services and even continue them. Maria and I have talked about obstetrical services across the state of New Hampshire, and we have maternity deserts where you have to drive a couple hours to deliver. We also know that there's a great need for expanded behavioral health services, and specifically maternal behavioral health services across the state. And yet people aren't stepping forward because of the financial situation that many hospitals find themselves in. Actually, at the national level, we're saying, should we reimburse essential services in a different way? Instead of relying on the free market economy, which we know probably has not been that successful in creating a network of services that are really accessible to all. What are the other ways of structuring, supporting those, both federally and at a state level, that will actually improve the outcomes for our patients? I would say that sometimes we get too focused on the business model of healthcare, but every single executive at this meeting said it's far more important, far bigger than the business model of healthcare. It's actually how are we taking care of our communities, and how are we really attending to both the quality of life of people that don't necessarily cross the threshold of our individual organizations, but live in and are an important part of all of our communities. That's how we'll truly actually improve health rather than just deliver health care.
Well, thank you for that observation, and I think that goes to this whole notion of understanding social determinants of health, understanding the importance of access to health care at the right time in the right place throughout one's life, and especially for moms when they are childbearing and child rearing. I want to go back to you, Heather. I want to thank you, too, for coming to DC to testify in support of the Triumph Act. And you alluded to it a little bit, but if you are comfortable, if you would share with this group why advocating for better supports for maternal health is so important to you.
Our moms are in crisis here in our state and across this country. More recently, the spotlight has been on in Duxbury, Massachusetts. It brought up the attention once again to maternal mental health. And all of the feelings came rushing back to me from when I tragically lost my sister over a decade ago to maternal suicide. She suffered from postpartum psychosis. And just 3 weeks after the birth of her first child, she took her life. She wasn't sleeping, she was withdrawn, and she had a lost stare that I'll never forget. I struggle to understand why and what could have been done to change her tragic outcome in the years since. She was told to go to the ER, which was no place for a new mother to go without her baby. This cannot be the only option for our mothers here. And yet, decades later, it is the only option for our mothers in crisis. We need to do better here for our moms in this state, and I'm extremely hopeful with the passage of the Triumph for New Moms Act that we can get that done.
Well, I appreciate that. Thank you for sharing your story.
Thank you.
We're all thinking of you and thinking of moms in crisis and thinking of families like yours that have been through
We
what you've
have
been
the
through.
momentum,
Yeah.
This really brought the spotlight
Yeah.
up again.
Okay.
Thank you.
Thank you. I want to turn to Jessica or Carrie, either one of you. Can you discuss how you and your teams at the Mental Health Center provide support for those in crisis and how you collaborate with medical providers in the area to address particularly maternal mental health?
Okay, sure. I first want to say, Heather, I'm very sorry for your experience, and it's sad to hear the only option might be the emergency room, and I want to say there is some hope out there because we do have other options that are coming to light, and part of that is our rapid response model of care that as of January of 2022 launched statewide. So the hope is that there will be and are other options for moms in crisis. And so part of what we do as a rapid response team is we have a mobile crisis team. This team is a 24/7 responder. We will go anywhere, anytime, to anyone in crisis and assist them where they're at. So if there's a new mom at home, for example, unable to leave, unable to go to the emergency room, having a mobile crisis team respond and work with her and get her connected. And a big part of what we do is connection and making sure that folks have that follow-up and the care that they need. It may not come directly from the Mental Health Center of Greater Manchester per se, but we're helping connect to medical providers, to other supports in the community to really help that person through the crisis. At the Mental Health Center of Greater Manchester, we actually started our mobile crisis team back in 2016, but it was very limited to our catchment area, just our Manchester area. So we're very grateful to now have this opportunity to go statewide. Anyone at any time can call the statewide access point number and be connected to someone who will work with them by phone, provide telephonic counseling, and if a mobile response is needed, will then access the mobile crisis team in the area that that person lives or within a 50-mile radius. This is really important because of the workforce shortage that we have had in mental health care. To be able to help each other in other regions to provide this has been very, very key. We will go out to the home. We have a mental health clinician and a peer, someone with lived experience, who will go to the home and provide the same type of emergency evaluation that that person will receive in the emergency room. So we do a risk assessment, we create safety planning. Our goal is to divert folks from hospital whenever necessary. We know that it is very crucial for someone with a young child, a newborn, to not necessarily have to go inpatient to a mental health facility. So anything that we can do to help provide those in-home supports is really important. There are times when we do need to look at hospitalization. We had a case last week that really kind of struck with us because it seemed very similar to what happened in Massachusetts earlier in the week, where we had a family member reach out through the access point, through the 833 number, had some concerns about a new mom, and we were able to meet that family member in the community, get a lot of information about what was happening. The new mom was experiencing postpartum psychosis and was really struggling and really needed to have inpatient level of care, so we did help facilitate that very quickly. Within 24 hours, she was receiving that care. Our care goes beyond that assessment, though. We do provide crisis stabilization for up to 30 days post-crisis, and what that does is help us to connect with community partners, with other resources in the community, or have them come in and start treatment with us at the Mental Health Center in Greater Manchester. So everything that we do is really crisis and beyond to really help connect a person to resources. We also have partnerships with our first responders. We work very closely with the Manchester Police Department, with AMR and Manchester Fire. So if there are responses to the community and someone is identified at risk, then we go out in real time to that scene as well, and we'll provide the same level of service. And I'll have Carrie talk a little bit about our other partnership.
Please do, yeah.
So the other thing that we do at our mental health center is if someone does end up going to the emergency room, like Jessica said, we have teams of clinicians in both emergency rooms here in Manchester, and there's that warm handoff. So the family that Jessica was talking about last week, we then support that family and that new mom in the emergency room, and hopefully get them to where they need to be as soon as possible. Also, sometimes people start in the emergency room and they don't need that, and so we can provide that assessment and then hook people back up with resources in the community, because our goal, even if someone does come into the emergency room, is to keep them home, especially a new mom. But people don't know where to go. They often go to the emergency rooms because that's what the history has told them to do.
Right.
And so our hope is to do that assessment and then get them hooked back up in the community and never have them go inpatient as long as they don't need that.
So how do people, I assume that in emergency rooms, they know to call you all, but how do people find out about the existence of your services, of the mobile crisis van? How did that community member who was a family member of a woman in crisis, a new mom in crisis, learn about your services?
We put our information everywhere. Primary care providers, community partners.
Yeah.
There was a statewide marketing campaign
Okay.
to educate the public about this other option. With the launch of 988, came with it also the clarification that there is also a local response,
Right.
in addition to a national response. So it's really about getting the word out there, making sure that we have our brochures all over the place, that they're given out to folks. We have responded to primary care offices, to OBGYN offices, and we are sure to leave enough material so that that can be given to folks
Good.
when they go home, so they know.
That's great. That's great. Susan, I was going to turn to you next just to ask you to talk about NAMI New Hampshire's work to support new moms and why access to critical maternal mental health care is important for moms and families.
Thank you. So as many of you know, NAMI New Hampshire is a grassroots organization working to improve the lives of all people impacted by mental illness and suicide through support, education, and advocacy. Last year we served over 40,000 folks, made possible, frankly, through the tireless efforts of our over 200 volunteers statewide, so I always need to give them full props. Nearly all of whom do this work because they too have lived it, whether themselves or through a loved one or a loss. So thank you, Heather, for your willingness to share your story to create this change. At NAMI New Hampshire, we do a lot of, we have education programs. Our Connect Suicide Prevention Program is a national best practice. And certainly we do a lot of education for healthcare providers as well as the community. We offer a variety of educational programs that are free for families and individuals living with mental illness. And we have a number of support groups. One of the silver linings of COVID is that almost all still are virtual. which allows people actually increased access so that, you know, if you're not in Nashua on the night the Nashua Group meets, for example, you can still access it. So all of that you can find through our website at naminh.org. I would want to say that one of the things, as I mentioned earlier, that we're really working hard on is making sure that this bill is successful this year in New Hampshire, and that indeed New Hampshire Medicaid will provide that coverage for at least a year postpartum for new moms. We know that between a week and a year are when most maternal deaths occur. And frankly, a mom who's experiencing a mental health crisis certainly means her family's experiencing a mental health crisis. Everyone in that household is impacted, and children are at significant risk, frankly, just because of the upheaval it can create in their own lives. We know how important moms are. And so taking care of mom's health is really how we care for the family as well. So our hope is that we will be successful this year. We look forward to working with all of our partners around this. Senator, listening to the conversation, we talk about mobile crisis, statewide mobile crisis, and New Hampshire rapid response rolling out a year ago.
Yeah.
Transformational moment here in New Hampshire. 988, that 3-digit number again, transformational moment for our country. We need geolocation, Senator. We desperately need geolocation on 988.
Yeah.
And then we can retire the number and stop having to parse out, well, if you don't have a 603 area code, but you're hoping to have mobile crisis come, make sure you call the 833 number.
Right.
It would be so much easier in terms of getting the word out if we could just say 988, that's it.
Yeah.
So I make that plea to you, Senator.
Okay, it's a good plea and understood.
Thank you.
Yeah.
So,
Thank
thank you so much for your leadership.
No, well, thank you very much for yours and for what NAMI New Hampshire does. And I still remember as governor talking about the mobile crisis goal.
Yep.
And it's really exciting that we've gotten there. So, thank you. Doctor, can you, just to broaden the discussion a little bit, talk about how we support moms in the workplace as well as at home? Because I think about this, look at this table that we've convened of people, we're all women. 75% of the healthcare workforce are women, physicians, nurses, nursing assistants. Many of these women are mothers. So how do we go about supporting moms in the workplace? And you're free to comment on anything else you'd like to comment on too, but I wanted to get a sense too of how we're focusing on working moms as they go through transition.
Yeah, so a couple of things. I think I would come at this both from being a provider in healthcare and the workplace and being a mother, but most importantly from the stories I see every day around from patients that I care for as an obstetrician, where consistently mothers immediately postpartum are being forced into making a decision between financial sustainability and caring for their children in a time of great transition for them, where there are a lot of pressures in introducing a new member to the family. You know, it's not like 6 weeks postpartum or 8, which is, by the way, too much of a short term because people are just adjusting, being able to even establish lactation. It's a time of a lot of transition and physical recovery.
Right.
Real significant physical recovery. And I think having sustained paid leave is really critical. I also think it should be more extended than what we currently define. And by paid, I think that women also have a penalty associated with childbearing, which is, it's considered a disability,
Right.
which is prorated income for many of those families. And for some, it's not even a benefit. So it is an additional pressure that adds to already a big stressful transition for families and individuals. I recall personally having my last child being in training and knowing that I only had 6 weeks and I had a baby at 29 weeks who had to go to the nursery. And I had to make a decision post major surgery. Do I go back in a week and not recover in order to have some time with my baby when my baby came home? These are not decisions that we should put women in a situation that they have to consistently make. I think the other area where we can continue to support women, and I think that the passage of this will be very important, is it takes time to establish lactation, to have support of other resources that are not considered traditional, whether it's doulas, whether it is also community health workers, because in many ways, with the way that we've distributed our families right now, there's an isolation, and we see that even more post-COVID, where women didn't have even the ability to go out and communicate with other women or engage in the typical support systems that they had. I think the other area is affordable childcare. Because that is another big challenge that I continuously see. And many times I find, even in our own health force, that childcare is so expensive. On average, for a family, it can be $500 a week per child. And if you think about the costs in a month, if you have more than one child, there's nothing really prorated. It becomes unsustainable, and to some degree, it forces people also into a decision that may result in lower income, lack of ability to really have progress, and really sort of sets them up really for many women, especially for long-term poverty and the cycle of not being able to progress and move forward. So I think those are some areas that we can continue to support women in terms of beyond just providing health care. It's really those things that support the social determinants.
Well, thank you for that. Are there things that you have all found in the healthcare sector, and I'll open this up to everybody in the healthcare sector here, in supporting women in the healthcare workforce that has been successful, or are you all hampered too by the lack of consistent state and national policy about things like paid leave?
So great question, and one that we struggle with. One of the things we're wrestling to the ground right now is childcare.
Yeah.
And not only the availability, but the flexibility around childcare. Many of our women in the healthcare workforce don't work 9 to 5.
Right.
They work 6 to 7 or 8 o'clock at night. New Hampshire does have some laws about sick childcare.
Yeah.
That make it difficult to create an environment so you can actually offer that. And we have to think about 24/7 childcare,
Yeah.
especially because many of our workers are actually working nights and evening shifts. And how do we really manage that? Because we're a statewide employer, however, it becomes difficult to do it for just one site.
Yeah.
Our employees live not only all over New Hampshire, but Vermont. And we want to make sure that we create access for everybody.
Yeah.
We have started a child care worker training program
Okay.
with a group in at least the Upper Valley to start to create the pipeline. But believe it or not, that is one of the obstacles, and one of the unintended consequences of COVID is that many child care workers have actually left the workforce.
Right.
So right there, we're creating obstacles for women.
Yeah.
We do look at our paid medical leave, and Maria, when you were talking about that story, I was going, do we allow family medical leave on top of maternity leave when we have a child that has to be admitted to a extended nursery or even to the intensive care nursery? And that's note to self, I don't know the answer to that. So we've got to go back and figure out how do we actually have those conversations for moms that really need our help.
Right. Well, I thank you both for your advocacy and being able to also tell your own story, but really expand it out to the story of so many moms and working mothers. And one of the things we know is that we still have, in an economy that has a workforce shortage, a number of workers, mostly women, who are saying that they can't come back to the workforce because whatever child care arrangements they had pre-COVID have either disappeared, or they have found other ways to live on just one parent income, whatever it may be. But between that and home and community-based care shortages, there are millions of workers around the country who say they would be in the workforce if they could figure out either childcare or home care for a loved one who's aging or has a disability. So we have a lot of work to do there. Maggie Minnick, I wanted to turn to you and just ask you about the Northern New England Perinatal Quality Improvement Network, which has quite an acronym. And you all are carrying out really important work to improve quality of care and outcomes for women and their infants. Can you just share a little information about a current project that you're working on, and whether a national task force that we called for in the Triumph Act is going to be helpful, or what, just generally, what's your perspective, and can you talk to us about a project you've got?
You bet. I am so grateful for the work you're doing and that you've done on this Triumph Act. It dovetails beautifully, actually, with the work that we've been doing for several years here around maternal mortality, and hoping to move upstream and prevent maternal mortality in our state. And also with some of the other social determinants issues and the rural, the lack of OB, the rural,
right.
In the rural areas, especially in the maternity care deserts. So those are areas of focus for us at NEPCRIN. In terms of maternal mortality, we partner very closely with our state, Department of Health and Human Services Maternal Child Health Group to understand the causes. Why is it happening here, and what is it that we can do to address that across our network? So we learn from the reviews that we do, and then we share educational, topics around that, so that we can hopefully again move upstream. In our state, sad to say, maternal mental health and substance use are by far the major contributors to why women die in the first year postpartum. So the supports of the Triumph Act around, and hopefully in New Hampshire as well, we will cross that finish line here this year, extending first of all your task force understanding again more about that the needs, and then extending Medicaid to the full year is super important, and also the mental health resources, I think, will go a long ways towards supporting people when they really need it most.
Okay.
So that's one major focus. Another project I'd just like to mention is our STONE project. It's a HRSA-funded one-year program where the maternity hospitals have closed their birth, well, I should say the hospitals have closed their birthing units. We've lost 10 birthing units in the past 20 years in our state, so I think 15 remain now, 15 or 16, 15 and a half right now. And that does leave people many hours from care, sometimes even prenatal care.
Right.
So in the best case in that situation, actually there's somebody to do prenatal care, but that's not always the case.
Right.
In the North Country and the swath across sort of the Lakes region over to Springfield Hospital.
Yeah.
So this STONE project is simulation training in obstetrics and neonatal emergencies. And that is where we send out a team for a full day training with a simulator and with somebody from our simulation center, an expert in the technology. And so we send out an OB, a pediatrician, and also we need 4 faculty, so it could be a family practice doc or an experienced nurse, and also the EMS folks. We partner with them to bring simulation training in those emergency situations to the emergency departments that no longer have OB, where they might experience, in fact, I just heard of a few this past weekend that happened in an unintended place, where they're just too far from a birth hospital, and that's where they land. Yeah. And then so we're partnering again with EMS to train their staff as well as the emergency staff in those rural hospitals.
Excellent. Well, thank you. Yeah. And I would assume that there might be capacity to make sure that there was, in emergency settings, at least some capacity for an expert in obstetrics to consult via telemedicine, at least in an emergency setting.
We're hoping to get there with the obstetrics department, and our resources are stretched very thin right now. Right. We do have that actually established with the NICU, with the ICN. Okay. So we have agreements with those hospitals that that we'll have a neonatologist on call who can see what's
Right.
happening with the baby and can help through an infant neonatal resuscitation.
Okay. That's helpful to know,
Yeah.
but still a lot of work to go.
Yes.
And we
Yeah.
don't want to be totally dependent on virtual medical care in
Yeah.
emergencies, to be sure. Okay. Thank you. Thank you for the work. Nancy and Mackenzie, Moms Rising works with and advocates for moms all across New Hampshire and the country. Can you talk to us about what you're hearing from moms about maternal mental health? And maybe Nancy, you could start with that. Mackenzie, what additional policies would be helpful here for maternal mental health? So Nancy, I'll start with you.
So hearing from moms, the stress is there. I'm actually very, very grateful that Dr. Patton over there mentioned, family leave and having to think about going back to work. That's one thing on their plates, trying to manage a new child at home, whether acclimating them to a family or this is their first child. You kind of get lost in that shuffle. And one of the number one things I hear from new moms is the isolation. You feel alone in these
Can I have your
struggles.
attention, please? Can I have your attention, please? We will be conducting a test of the fire alarm system in this building. This is only a test. There's no need to evacuate. We're testing the fire alarm system in this building. This is only a test. There's no need to evacuate. Thank you.
Being flexible is one of the things.
Being flexible is very important. But you were talking about isolation.
Yeah, so
Yeah.
I'm hearing a lot from moms about feeling isolated and not having the ability to even chat with one another,
Yeah.
to learn about the struggles and being able to help identify. I also want to raise up that, this is a passion project for me as well, because I also want to raise up moms who have lost children.
Yeah.
That is a group of families that a lot of times are often overlooked, especially when it comes down to maternal health. We don't have, I say we because I lost a child as well, and I only had 60 days to be able to access mental health services, and it took about 3 weeks for me to even be comfortable going out and talking with anyone. I spoke with a mom this morning who has had 4 losses, and she also has utilized Medicaid during her pregnancies as well. And we were talking about how, there's a lack of being able to
May I have your attention, please? May I have your attention, please? There has been a fire alarm reported in the building. Please proceed to the nearest exit and evacuate the building. May I have your attention, please? May I have your attention, please? There has been a fire alarm reported in the building. Please proceed to the nearest exit.
It works.
It does. It does. So with that being said, I was talking about moms who have lost a child and, are also, having grief. And I always say grief is like a ticking time bomb. You don't
Yeah.
really know when it's going to hit you,
Right.
and you don't know how hard. One of the things that a lot of moms have access to, moms that are able to bring their children home, they're going to their pediatrician. They have more exposure, to doctors and other professionals to be able to let them know, hey, maybe there is something going on there. Opening up that conversation of how are things going. But when these moms end up losing, their access to healthcare, not only are they not in front of a pediatrician or, who are trained to look at these things, but also they don't have access to go to a doctor themselves in general. So they're even more likely to slip through the cracks when it comes down to these things. So that's one big thing that I'm hearing from moms, and then again, the moms that have taken children home, those added stresses of trying to find childcare, again, having to go back to work with paid leave. And I want to say, another big one, just recently was just being able to access food, formula.
Yeah.
We saw the formula shortage that just happened. When you have all of these added stresses in there, moms have the tendency to just kind of put ourselves on the back burner. But there's so much danger to that whenever we do put ourselves on the back burner, and the lack of self-care in order to be able to care for our children, our families. And it's not only within the family, but also you have to think about the communities as well that
Right.
it also affects. We're definitely seeing that with what was going on down in Massachusetts as well. So those are some of the things that I'm noticing.
Yeah.
Yeah. I'll just say that, we're so excited that Triumph has passed, and thank you so much for your leadership on that bill. It's going to seriously help a lot of women access mental health services. There was also a critical piece of legislation that passed called Into the Light for Maternal Mental Health and Substance Use Disorders Act, which establishes funds to look at mental health and substance use for women perinatal.
Great.
I took everything I had and made to sit here and behave while Dr. Padine said paid leave and childcare, right? Because maternal health is so much more than that number of maternal mortality. The fact that we look at maternal health and we say the baseline is did you die should be seriously concerning.
Yeah, right.
Women are more than just, producers of children. So yes to paid leave, yes to childcare, yes to access to infant formula. But looking forward, we live in one of the richest countries in the world, and Black women are still dying at 3 times the rate that white women are. Native Americans, 2 times the rate that white people are, and Hispanic folks 1.8 times the rate. What is going on? We are doing something wrong when Black women are dying 3 times more than white women. So there's a piece of legislation called the Black Maternal Health Omnibus Act of 2021. It's an omnibus bill, so it's got a lot of meat to it, but it looks at addressing social determinants of health, particularly for people of color. It funds community-based organizations who are looking at those social determinants of health and working to improve those outcomes. It funds, it supports maternal mental health conditions. It invests in digital tools like telehealth so that people can access care more often. It invests in maternal vaccinations, a whole slew of things it does, but I think, looking around the room, New Hampshire tends to be a really white place, and we need to be thinking about the moms of color who are dying at very alarming rates. So I'm hopeful that we look at that piece of legislation and we can pass that forward. And then to sort of piggyback off of what Nancy was saying about moms who don't come home with their babies, there's a piece of legislation called the Shine for Autumn, the Stillbirth Prevention Act. 23,000 babies are dying every year in the United States, and this piece of legislation looks to study at why babies are dying in one of the richest countries in the world. And when we better understand why that's happening, we can maybe help some of these moms. So we're severely committed to ending some, frankly, racist embedded culture in our healthcare system and promoting health equity so that all moms can have an equal chance at living long, healthy lives with their babies.
Absolutely. Well, thank you for the work you're doing, and thank you for raising the equity issue as well, which is an issue throughout our country and in New Hampshire as it is everywhere else. And one of the things that Dr. Padine, as you were talking, I was thinking about too, one of the reasons that Senator Whitley's bill in New Hampshire to get Medicaid coverage postpartum for a year is so important is of the decision points that women have postpartum in a economy that doesn't offer everybody paid leave for nearly long enough, and at a time when women have so many other things on their plate, the notion that you might need to stay home and stop working without access to health care, which obviously is often coupled with work, is another really critical stressor, and also really can impact whether that mom is going to get health care in that postpartum year at all. So my kudos to Senator Whitley for spearheading this with other partners, and I understand it's a bipartisan
Can I have
effort.
your attention, please? Fire alarm testing in this building is now complete. Please treat all future alarms as real events.
Fair enough. And so anything that, we have a couple of more minutes left, just anything that any of you want to comment on in what we've heard, and Dr.
Yeah, I think the other thing we haven't really commented on beyond those really extending postpartum care and the way we think about it is access to reproductive rights for women, and being able to actually have appropriate time for family counseling and for follow-up and coverage for that as well, which I think is very important for a lot of women, again, because many of them may not be coming under the current sort of coverage at 6 or 8 weeks and still need to have an encounter to be able to plan appropriately, particularly when they're going through a transition of adjustment and having to care for this new family member. And to your point, thank you for bringing up the issue of equity in healthcare, because I think if we look for most communities of color and other communities in this country, it's really the management of chronic disease that extends beyond those 6 to 8 weeks that can make a significant impact. We know that many communities, particularly Black women, suffer from more cardiovascular disease, diabetes, postpartumly, and initiating someone on therapy that then they don't have that continuity for chronic care is a contributor to some of what we are seeing for that population in this country.
And just piggybacking off that really quickly, I'd love to see us work to make sure that the perinatal workforce reflects the communities of color that we're serving, right? So that every woman can have a birthing experience that she feels confident in and comfortable.
Yeah. And Senator Whitley, that's one of the things that I think your bill also does, is provide coverage for a number of different kinds of perinatal workers, from doulas to other kinds of birthing coaches. And if you want to comment on that for a minute, yeah.
Yeah, thank you for that point. So I'm joined by Lisa Soroy and Patricia Tilley from the Department of Health and Human Services, and really have learned from them and from the folks at the table about the importance of filling those gaps in the services, those postpartum. So not only do we need to extend coverage, insurance coverage, we also need to make sure that all those services postpartum to improve to improve outcomes for babies and for moms are there. So the Momnibus is looking at adding doula services, lactation services, donor milk, something that we have heard that Lisa has worked on. You talked about the infant shortage. There are a lot of babies that aren't able to breastfeed, and so they're going to need donor milk. Those are our sickest babies, and so we're going to move forward and include that in the Medicaid program too. And then lastly, Lisa has worked for many years to improve workplace supports for nursing mothers, so that's included there also. If you want to say something about that.
Yeah.
Well, I just want to say thank you for helping to get the Pump Act passed this past year.
That was a good one. Yeah, that was a good
We
one.
have been working really hard in New Hampshire to have state legislation for moms who return to work, and it had been successful. So this is a really great step forward for us to be able to go back to work and have access to pumps. So thank you for your leadership there.
Oh, great. Thank you very much. Anybody else? I was seeing hands over this way, so please go ahead.
I guess I wanted to piggyback on what Nancy had said about moms that don't necessarily bring their babies home, and whether it's because they aren't able to care for them or because something happened. We do have a homeless outreach program at the Mental Health Center in Manchester, and I think that's an area where trying to find moms either who need care before they have their children, or that they return back to the community without their children. And I think that's an area that we don't necessarily focus on, and making sure that we don't lose those moms in the cracks, and making sure that they get the mental health care and physical health care that they need as well.
Excellent. Thank you. And yeah, Heather.
And part of that into the Light Act that passed, also screenings. Screenings need to be done everywhere.
Yeah.
And we do it here at Dartmouth Health Children's, here in Manchester, Bedford, at the pediatrician's office. It's not done everywhere in the state.
Yeah, okay.
And that's where we see our moms the most,
Yeah.
at the pediatrician. So.
That's right. Yeah, that's right. Yeah, okay. Well, thank you all. I'm looking at the clock, and Courtney just stood up. So thank you for the reminder. I will just again thank you all for your work. Keep talking to Team Hassan. The whole federal delegation is obviously committed to working together and to finding partners, not only in other parts of the country, but on the other side of the political aisle, so that we can keep focused on this. And also a thank you, Doctor, to the reference to reproductive health, because that is one of the areas that unfortunately is pretty politically divided right now. Not entirely, but pretty politically divided, and we need to keep finding a way to get these necessary services to women, and to treat this as the healthcare issue that it is. And so I appreciate you reminding us of that too in this discussion. So thank you for your work. Stay safe, everybody. Keep in touch, please. And as we settle into this new Congress, I look forward to working with all of you again. Thanks.